Hi, my name is Candice Hillegas, and today I will be discussing parkour for older adults. The news article I will be presenting is from US News, and it's entitled Parkour for Older Adults, A Prescription for Fall Prevention, and it discusses the growth of parkour programming for people 50 and over. Before we get into the meat of the article, let's look at the importance of fall prevention. According to the CDC, more than 1 out of every 4 older adults aged 65 and over fall every year. And 1 out of 5 of these falls leads to serious injury, like broken bones, especially hip fractures, or head injury, including traumatic brain injury. More than 95% of hip fractures are caused by falls, and most falls are caused by a combination of risk factors, including strength and balance. And the more older adults are afraid of falling, the more sedentary they become, which in turn increases their risk of falls. So what is parkour and what is its role in fall prevention? According to the article, parkour is the practice of using body movements to efficiently and creatively overcome obstacles in the environment. It is important to note that this version of parkour in their programming is not what we see in TV or movies. It's not people jumping over trash cans and hurling themselves off buildings. This version of parkour is really about older adults navigating their environment. Some of the benefits of parkour-based fitness and falls prevention programs, according to the article, are the execution of 2 simultaneous tasks, the strengthening of muscles and teaching proprioception. Parkour simulates real-life scenarios, and most importantly, it is spunky, youthful, and fun. So to go into these in a little bit more depth, parkour programs use a lot of exercises that involve executing 2 simultaneous tasks. As we discuss in class, everyone experiences at least slight cognitive changes while aging. However, many older adults experience more, ranging from preclinical symptoms to dementia symptoms. And dementia symptoms are linked to falls and fractures. So we really want to program to prevent this cognitive decline. And dual task training, as seen in these parkour programs, can increase cognitive function as well as balance and gait speed, which again are 2 very important factors when discussing fall prevention. Some example exercises are, as you see here, walking on planks while passing a ball in between their legs. They also discussed exercises such as side planking against a wall while writing the alphabet with their inside hand, and also squatting while passing heavy books in between their legs. Next, parkour strengthens muscles and teaches proprioception. So, as we also discussed in class, muscle strength and power contribute a lot to balance. And strength exercises can train recoverability. So, if an older adult has more lower body strength, it is more likely that they can recover if they slip or lose their balance a little bit. And then proprioception, so people don't fall when they're just standing there. People fall during activities that involve motion, which stimulates the sensory systems. And the sensory systems also decline as we age. So training this proprioception, as parkour programming does, really emphasizes the awareness of the older adult's body in space and their movement through the environment. And so training this proprioception is very important in fall prevention. Parkour also simulates real-life situations. As I discussed a little bit in the last slide, falls don't happen when people are doing something drastic. They happen during daily activities. So if an older adult is carrying groceries and steps up on a curb and trips, let's say, and parkour really likes to tailor to these real life situations. One example of this is called a chair swing. So older adults sit in a chair and they swing their legs over to simulate an obstacle blocking their path. And lastly, and in my opinion, most importantly, parkour is spunky, youthful, and fun. The spirit of parkour is really a unique thing, and it increases motivation and confidence because the parkour programs aren't boring. Not to drag on any other fall prevention courses, but it's just this new fun type of energy that's injected into these classes. And doing something fun really increases motivation to continue going to these classes and working on fall prevention skills. Um, and it just increases older adults' confidence. I mean, as a young adult, it'd be cool to say, oh, I do parkour. But as an 80-year-old, it would be even cooler to go brag to your friends and say, guess what? I do parkour. Um, and lastly, the gamifying of these exercises through parkour improves retention of the skill. So I went out and did some additional research, and this study looked at the effects of modified parkour exercises on arterial health and fitness components in elderly individuals. And this study found two things that the article had already discussed, which are the prevention of strength decline and the prevention of flexibility decline. But two novel findings were that parkour could reduce blood pressure and wave reflection in older adults, as well as hypertension and cardiovascular events. So this doesn't directly link to fall prevention, but it does, of course, link to overall health of older adults, which is extremely important. And I also looked at another study that compared postural control in parkour athletes compared to recreationally active subjects. Of course, postural control is a huge, huge component of balance and reducing fall risk. So this study the indications of this study were that parkour athletes had greater balance control when their vision was removed, and they were less dependent on visual cues and proprioceptive inputs for maintaining balance. As we discussed before, training your sensory systems is vital when you're an older adult to help with your balance, help with your recoverability. So parkour training may improve your postural ability in specific postural conditions. So the takeaway is that parkour is an easily adaptable and safe, yet also physically challenging venture for older adults. It increases the likelihood for seniors to engage in their environment, rather than avoiding certain situations or becoming more sedentary. And most of all, it is an effective and exciting tool for fall prevention. These are my resources, and I really suggest you check out that article. Thanks.